During the Arlington School Committee meeting on October 8th, there was a large showing of support for tenants of the Gibbs Building. Representatives from Learn to Grow, the Arlington Center for the Arts, the Kelleher Center, and Schools for Children voiced their opposition to any plans that may displace their programs from the Gibbs. Although some proposed plans to reduce student overcrowding in Arlington included reactivating Gibbs as a public school, the committee is looking at all options.
There's only one reason why we even consider or even put it as a possible one of many options looking at this, and that is that the schools are bursting at the seams.
We are with you, and we want to find a great solution that preserves these valuable programs and meets the space needs of the children in our school system, that is also something that is affordable and the residents of the town are willing to pay for. So those are the constraints that we have. And the more you are able to convince your friends and neighbors that this is something worth having and worth paying for, the better solution we can come up with, which is why I am so glad you're here, so glad you were here last time, so glad you decided to become engaged in this process and willing to present your ideas to us.
At the October 19th Selectmen's meeting, Daniel Carton of the Massachusetts Patient Foundation presented a plan for a potential medical marijuana facility in town. With concerns for safety brought up, proposed security measures were addressed.
The systems that we are actually including in our security design, the security systems themselves, access control, surveillance, panic and hold up, video intercoms, and as well as a redundant security system that's part of the requirements of 725.110. That means is that there is an actual separate alarm company who will actually be providing a redundant security system for the site.
The way these are designed is they have a man trap or a sally port, right? So a patient or their caregiver will present themselves outside of the dispensary, not even able to come in, and they'll present themselves with their state-issued medical use of marijuana identification and a second form of ID. Then they'll be let into this sort of sally port or man trap area, at which point there'll be a security guard that will inspect their identification again, make sure that it's valid, make sure they're allowed to be in. In Arlington, MPF, Massachusetts Patient Foundation, only proposes to cite a retail dispensary, not the cultivation portion. So the cultivation portion is frequently much larger and a different set of security requirements. But during business hours, there will be a security person on site all the time, absolutely.
So is that a man trap, you called it, I think? Is that like a jewelry store would have, a very high-end jewelry store?
It's you can't really get in. You present your ID outside, you present it again inside. And and it's a requirement by the Department of Public Health. One of the things I've been fortunate enough to do is work with the inspections department through a number of dispensaries all throughout the Commonwealth, and we've gone through security plans over and over again, and I'm happy to work with this group because I know they have the resources to implement the utmost security.
Full versions of these meetings can be viewed at vod.acmi.tv.